Good morning, everyone, and welcome to DOH compliant post-COVID cleaning and disinfecting procedures. This morning's session is brought to you by our diamond sponsor, NYSER, and our gold sponsor, Nagel. We're grateful for their generous support and hope you'll visit them in the virtual exhibitor hall. Our speaker today is Heidi Wilcox, a national green cleaning and infection control process and protocol specialist in different types of facilities. Currently, her work focus is on the Jansan industry. Her expertise is helping end users streamline their process, connect with vendors and manufacturers who will be partners, as well as bring innovative products and equipment to facilities. Her passion is to ensure health and safety for workers, clients, and customers, as well as the environment. She earned a Bachelor's of Science degree in microbiology from UMass Amherst and a Master of Science in Environmental Studies and Atmospheric Studies from UMass Lowell. Her doctoral work has been on her large body of work in public health, especially K-12 schools, and is currently concentrating on less toxic disinfection to help with COVID. Heidi, I'll turn it over to you.
Great, thank you, Luann. I'm very excited to be here. I always appreciate the opportunity to come and speak to people and hopefully help clarify some of the things that are happening in the industry that are confusing, and to say the least, we're in some confusing times with the pandemic. So next slide, Luann. And next. So what I thought when I was asked to speak today was about COVID. So we're all dealing with it, how to get schools open, how to be hybrid, how to, keep and maintain our facilities even if we're virtual. I know here in my area, we have people going and kids are going in 2 days a week, or there's no kids in, but all the teachers are in. So we still need to handle the facility, and there's a lot of confusing information out there. What do we use? How do we use it? What's the real science behind COVID? What do we know now? What don't we know? So I want to cut to it and get to, what we know and the science, what to do, how to do it, and then how to keep all the agencies that may be after you happy if we can. Next slide. Next slide, Luann. So a little about me. Yes, I'm a lifelong New Englander. You will hear my accent. I can park your car for sure. So as you heard, I'm a microbiologist, a chemist, an engineer. I look at processes and I look at data. So when someone brings me a new product, I look at the data. When a company wants to work with me or a manufacturer, I always tell them that we need to prove your concept to the end users, show something about we increase the level of clean or disinfecting, we save money, we save time, like there has to be something in it. I've been doing this for 20 years. I tell everybody I started when I was 10. I ran a laboratory for Massachusetts testing alternative chemicals for almost 20 years at UMass Lowell. So I like to look at green, and as you can see, air quotes, less toxic chemicals. And I like on-site generation. We'll talk about that if you don't know about it. Handle some of the issues we're dealing with today with COVID. I look at processes and procedures, training, education. I look for the truth in data and marketing and claims. So a lot of people are making claims right now. A lot of people are saying a lot of things about their process, their service, their this, their that. I try to help people on how to really figure it out. And technology is where the industry's headed. So if you haven't embraced it, we need to embrace it. Sustainability matters now. A lot of the issues with supply chain have been around plastic bottles and pumps and things that we can't get a hold of that are things we throw away. And then the supply chain right now matters. Is something coming from overseas and out of stock for months? A part of the chemicals to make the chemistry that you use hard to get. So are you having a hard time getting different things like hand sanitizer, disinfectant, and certain cleaners? So we'll talk about that. Next slide. So what we'll talk about again, COVID fact and fiction, right? We hear a lot. What's required and what is suggested. Most of the things that have come out from the CDC, health departments, and all this other stuff are suggestions and recommendations, but people are adopting them. How do we actually protect the facility from COVID? What should we consider adding to our programs now? Supply chain issues, health and safety for workers and users of the facility. A lot of people are always talking about what is, the safest for the student and the worker and the staff and all the stuff. I really also wanted to talk about and keep in mind that there are people doing this disinfecting, the sanitizing, and the cleaning, and we need to protect them as well. And then how to evaluate new products. Next slide. So COVID. Let's cut through the confusion, talk about it. So COVID, or the coronavirus, is very contagious. The thing that you guys deal with all the time is norovirus, or the stomach flu, every year, and that is very, very, very contagious as well. So a coronavirus, or COVID-19, is not a new type of virus. The flu is a coronavirus. The SARS virus from a bunch of years ago, that is also a coronavirus. So what is making COVID so tricky for us is this one. Obviously, we have a lot of asymptomatic carriers, meaning they have it, they don't know it a lot of times, and they can spread it without knowing it if they don't follow correct procedures of wearing a mask and doing the things that we know we should do. And then it's very contagious, and some people have very, very bad symptoms and may be disabled for their life or die. And then we have some people that get through it just like a cold or a flu. So, and then the incubation period is very long. And what this means is that, you can go somewhere and get it and not know it, because you may not show symptoms from 3, 4, 5 days up to 10. So it's a lot of time you could be walking around, depending on what your lifestyle is, what your job is, and things like that, with symptoms, and be shedding them. Okay, so this strain, this virus has mutated. The flu mutates every year, so don't get scared about it. Different mutations may be more transmissible but less deadly. May have a stronger reaction and you get a higher fever, but it doesn't last so long. Different strains do different things, just like the flu every year. The things that we do know is that the primary way that COVID is transmitted is through respiratory droplets and by not wearing a mask. So there's a statistic that's been out there for a few months that if everybody in the United States wore a mask when they were in public around people that they didn't know what their daily lives were, that we would pretty much get COVID in control within 2 months. The problem is we don't have a federal mandate. It's up to the states. The next most prevalent way to get COVID has been through the air, we're finding. Okay, so, and respiratory droplets don't mean just coughing. It means talking, breathing, laughing, anything else, working out, it's not just coughing really hard. It's really just, if someone was here with me and I had it and I was talking, excuse me, sneezing, they could get it if I had it. And then surfaces. So this is what we've known. It feels like 3 years. We've only been in this 6 months. And that's a very short time for science. So these are facts, okay? And so surfaces are where we live. So it's not as prevalent to get something from a surface, because if you wear a mask and you touch a surface, you will not be touching your mouth and face as much with the mask on. The children that we're dealing with in K-12 schools, they do get it, and they're a serious source of spread. and transmission. And there's been some studies around, I think in Florida a couple months ago, they tested a bunch of children, and 1/3 of them had COVID and had no symptoms. So it's very, very serious about if someone feels sick, they should stay home. Kids need to wear their masks. They need to not trade their masks and say, oh, I like yours, I like yours. And for us to really keep on that if you're having children come to school. Children generally have less hospitalizations, but there's always exceptions. Hi, Keith. Next slide. So what we know works, science and proof. So these slides that you're seeing here is they've been floating around for a while. A lab technician decided to cough on a slide that would grow bacteria with a mask and without a mask. The mask she used was just a regular cloth mask that we're all using and without a mask. So that's just the regular bacteria in our mouth that she coughed, and that's what grew. Some of it's good, some of it could be bad, but there's your proof. You know, a lot of people want to talk about, you know, do masks work? Does this work? Do I need an N95 mask? You don't. N95 masks are for our healthcare and our frontline workers. And basically, if you use these are reusable or a one-use mask, the blue ones, and you social distance when you can, and you wash your hands and you sanitize them, this will really stop the transmission of COVID. It's not a secret anymore. We know what to do, okay? And I'm sure all of you are doing this already. Next slide. So COVID is easy to kill on surfaces. So if you're a vendor, if you're a distributor, if someone in your school district comes to you and says you have to use 17 layers of disinfectant and sanitizer and this, that, and the other thing, you don't. We're worried about if COVID gets in your system. You know, so if it gets in your facility, then we need to really think about our protocols. Do we need to shut down? If one student gets COVID, do we need to shut down the facility? If there's a cluster because of athletics or other things, do we need to close down? And what should we actually be doing? So more on the COVID facts. The US is over 200, and it's probably 10,000 people that have died at this point. We have about 40,000 cases a day in the US. You know, if you average that, it's, you know, 8,000 or 9,000 a state. It's not really what's happening, but that's the average. And it's still way too many. O blood type, if you're lucky to have an O positive or negative blood type, you get COVID less than others. We know that. I don't think we know the mechanism yet, but we do know that. Gloves are not needed to be used. They, you know, they're needed to be used by your workers for general protection from chemicals, but they're not going to protect us from COVID. Basically, if you're going to touch something on the surface and you get it on your hand and touch your face, you're going to get it on your glove as well. I guess maybe if you use gloves, you're not touching your face with the gloves, but ultimately you'll have the mask on and the mask will stop that. So gloves are, you know, I see people out and about, different places wearing gloves in the grocery store. It's not needed. And then training, written SOPs, upgrading your tools, your equipment, and your chemicals is what you should be doing now. So basically what we're going to hear in the presentation moving forward is, if you had a good system before COVID, you're probably in good shape. If you were just getting by, you need to step it up. So we need to plan for the whole facility, surfaces, the air column, because that's the second most prevalent way we get COVID, and then HVAC systems and how the air is brought in. Next slide. So I believe COVID's going to be around for a while. We have a lot of people working on vaccines. They take time. They do, and this isn't time. So even if one comes out next year, then we have to get everybody on it. So it's going to take time for all of us to get it. And then will it be, you know, a vaccine that eradicates it, or that we have to have a vaccine every, you know, every season? And that could happen. We just don't know yet, but we do know that there's a lot of great people out there working very hard coming up with vaccines. So basically with COVID, there's two things to consider with this, right? So there's the biology of it, how it's transmitted. Okay, so that's the droplets, that's the touch, that's the air, and then there's a cleaning and disinfection for it. So the transmission about it, if you see anything on TV or written, and it's, you know, a doctor is talking about it, doctor MDs are dealing with the transmission of it and how to help the symptoms. People like myself with doctoral education, I work on the transmission and the cleaning and the disinfection of it, and how we can have systems to handle infectious diseases, which we've dealt with. You've dealt with your whole career and probably haven't even thought about it. Cold, flu, MRSA, norovirus, all those things are pathogens and are infectious diseases. Okay, so, you know, it's not business as usual. Okay, we need to start looking at other things. So we need to start looking at more than just the surfaces that we're cleaning. So we need to look at how we're handling the air column and disinfecting it, and using electrostatic sprayers, or using air purifiers with UV in them, or putting things in our HVAC system that handle the air coming back in to the facility. We also need to think about outdoor places where the kids may be, playgrounds, benches, and things like that, and handling them differently. And some of this, which we really need to get, is that this is custodial, so what products you're using, what equipment, and other things. And then it's also about facility improvements. So what we need to figure out is not just going to be about custodial. It's going to be about getting the buy-in for facility improvements, these air purifiers, maybe antimicrobial coating and things like that. So, you know, what disinfectants are we using? What other things are we using? How does it handle in the indoor air quality? How does it affect it? And then I hear a lot of things about, oh, you know, when I've traveled a little bit, so, you know, Avis Car Service or JetBlue, or, you know, the store I go into, we're doing all of these processes. Well, my thing is always, that's great, you do the processes, but what's the chemistry? The process could be good and the chemistry could be harmful. And I don't think enough of us are asking that question. Next slide. So we've talked about this: breathing, talking, laughing, coughing, sneezing, respiratory droplets. Basically, anytime you're awake, even if you're not awake, you're breathing, but, you know, anything that you do, breathing wise, air wise, talking, can help produce respiratory droplets that either can get to a person or stay in the air, and can help with transmission and get people affected. Then contact with droplets traveling in the air. So basically, there's things in our air that we don't even know that are there because they're so small. Okay, there's particulates in the air, and then there's things like droplets, right? So you can cough in this room, and then down the hallway, through air moving through the facility, we could technically find those same droplets. So again, I can't say it enough. Mask, 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 mask. So surfaces are less important, but they're still important. Okay, so we need to think about the processes and the products and going beyond what I call T=0, because once you clean or disinfect a surface, then the air deposits and it brings about the things that are in the air, and we have to deal with that. So next slide. So what's a recommendation, a suggestion, a requirement, a law? Okay, so we have everything from the federal agencies, the CDC, the FDA, the EPA, national agencies, the World Health Organization are all giving recommendations on the science and the things that we find, okay, and what will kill it, what we do to stop the transmission, and things like that. So all the things that we really know about as far as wearing a mask and cleaning and then sanitizing and disinfecting and sanitizing your hands and washing your hands is all things that we know, and that's why they're all recommended by these agencies. And then we have trade agencies that are helping us with knowing about better equipment and other things like that. And then our states, in your school districts, in your health departments, and all these things are also working off these federal and national things that we know and putting those in as a recommendation, right? Most people are taking the recommendations, the guidelines, the suggestions, and using them, right? Because a lot of them are based on science, but they're not laws, okay? Laws, some states require masks in public, some don't. I'm from Massachusetts. It's a law that you do that and you can get fined. Laws right now or have been about number of people in gatherings inside and out, whether you can eat at the bar or drink at the bar. You know, using the N list for your products is pretty much a law at this point. Those are the things that the CDC, the FDA, your health department is all going to want to see as a product that's off the N list. Yep. So there's a question coming in about people are worried about green products working, and I totally understand that. Right now, green products, and I usually go green because it's hard to define green. I call them less toxic products. Those are third-party certified by Green Sale, Ecologo, and EPA. And when you have a third-party certified product, the lab that I ran for 20 years was one of the preeminent labs in the country that did that testing. And what it did was it showed performance, so soil removal, and it went through a level of toxicity, so carcinogens and neurotoxins and reproductive toxins, and those things were taken out of most all green formulas, right? And then, because what we talk about now with a lot of cleaners is, you know, defatting and drying of hands, you getting dizzy from breathing in fumes from maybe probably more disinfectants and sanitizers, burning of your eyes or your nose, your respiratory system. Again, a lot on sanitizers and disinfectants, but any of your cleaners that are colored or fragrance, those situations don't have to be disclosed. It's supposed to be disclosed. It's supposed to start this year. The pandemic came, so we're probably behind on that. But those groups, the dyes and fragrances, are synthetic chemicals, and they can harm you. So green cleaning, those cleaners are most major manufacturers have them, and they go through the same process. So we have basic toxicity and basic performance covered, but they need to be used in a system. So if you're just throwing in a green, you know, all-purpose cleaner, but not, you know, other green products, or a green floor stripper, but not other green products, your product isn't going to work. Like, it has to be part of a system, and that's what's happened over the years. And many people think green doesn't work, green doesn't work. You're right. It really didn't work 15, 20 years ago. It does work now. But you need to embrace a whole system of green, okay? And you need to retrain. The formulation is different. So I hope that answered that question. And then you guys have your own coronavirus health website and landing pages right here at the bottom of the slide, and that's where, you know, a lot of your recommendations are coming from, and the things that you need to do, as well as from your school department and things like that, and Department of Health. Next slide. What do we do and what are we doing? So someone just asked to talk about antimicrobial coatings, and I will talk about that in a minute. But what I want to tell you guys, and I want you guys to understand, that if you were on top of your systems and what you were doing at your facility already, if you had good training, if you had good standard operating procedures documented, if you had good equipment and good brooms and mops and tools and things like that, and you were disinfecting and sanitizing and looked at those when you're using the best product and how to apply them and when, you were in front of the 8 ball, not behind it. Okay, I think most people realized that they had things they needed to upgrade and they needed to step up on, and this is the time, because when you couldn't get money before from your school district, you can get money now for COVID, and this is all just the basics. So what we did do should have been what we were doing. So what we're doing now and stepping up some things is what we always should have done. So the right process and procedures, equipment and chemistry. So, the pandemic has given us the time and money to do some of this right? But we're also asking you guys to do more, right? To disinfect and sanitize. So where do we get that time? We're going to talk about that, but you always clean first and sanitize and disinfectant. One step does not work. It is not a good cleaner. It is not a good sanitizer or disinfectant. Cleaners are about what's in the chemistry for cleaning. Sanitizers and disinfectants are about what's in them to kill pathogens, meaning fungus, antimicrobials, bacteria, virus, right? So we want to kill all those things. And dwell time, or how long a surface is staying wet with your chemistry, is of paramount importance. So when you do a one-step process, we're spraying and wiping, and we're not keeping any sort of sanitizer or disinfectant component of those 2-in-1s wet long enough so they're not doing their job. So what we're doing is we're putting potentially toxic chemicals into the environment, and then what we're doing is we're leaving those behind, not enough of it to do the job, and we're just not doing what we think we're doing. So high touch points, we need to do those. We've always needed to do those during flu and cold season. We now need to do them during the pandemic. We need to think about indoor air quality, and that is really around a lot of times what chemicals you're using. We need to talk about the standing operating procedures. So before the pandemic, we did a little bit different procedures during flu and cold season than we did when we weren't flu and cold season. As long as we're under the pandemic, we're going to be using those a little bit higher level procedures every day. And then we need to think about the health and safety of everyone and the environment and sustainability. Next slide. So are you doing the same? Are you trying to do more with the same staff or the same resources? That's the question here. If you weren't able to get more full-time employees or part-time employees or people to help, then you're stuck doing more work, probably for the same pay, with the same resources, and maybe the same time. Maybe maybe your facilities or your school districts aren't authorizing overtime or making your workday a 9 or 10 hour instead of 8. Those are all things we need to consider now, because if we're asking people to sanitize/disinfect your facility every day, then that takes time. So how do you do what you need to do? For me, it's about technology. Technology and cleaning will save you time. Training will save you time. If I can save you time during the cleaning phase, then you have more time to sanitize and disinfect. Maybe you have more money and resources. If you do, capitalize on that. Take that money, take that time, take that training. So what do you spend your COVID money on? You spend it on training, some consultants or experts in different areas to help you. Not everyone should know everything. You upgrade your equipment and technology to deal with it. And then we have supply chain issues. So we want to upgrade to deal with that. So everybody that's on the other end of the computer that's listening to me is an expert in your facility, right? But this is beyond that, right? This is beyond that. This is chemistry. This is science. This is more. This pandemic has brought us more. So piloting products and equipment is important now. Finding alternatives to things that are out of stock is important now. And then seeing price gouging is what we're seeing in some of this equipment, and that's not okay, but it's happening. So how do we deal with it? Next slide. So you have to be open to capital investment. I know we're used to buying a scrubber once every 5 years. We're used to buying this once every 3 years. We buy cases and cases of concentrated chemical products, of all-purpose cleaners, glass cleaners, floor cleaners, on and on and on. And that's how we're used to buying generally in this industry. Well, we need to start looking to technology to handle supply chain and gaining time. All right, so now we know we need to disinfect everywhere or sanitize everywhere every day. How do you find that time? Training, technology, and it's proven. So in Salt Lake City in 2017, I was called in to work with some facility managers out there that I knew to do a project for Healthy Schools campaign, and they were doing a 3-day, 3-day event. They were going to do a tour of the school, show the new technology, talk about it, and things like that. So I was called in, and what we did there was we put in the best of the best that we knew of 3.5 years ago, which was spray and vac machines. We changed the training. We changed the process cleaning for Healthy Schools. That training eliminates the stops and starts of our teams of, maybe going in and walking out with trash and going in and walking out with trash, and basically streamline the system and how to cut down minutes and hours sometimes. And then what happened was when we did the training and we brought in different things like on-site generation, aqueous ozone, hypochlorous acid, electrostatic sprayers, training, different equipment or tools like poles and pads instead of maybe hand cleaning desks and conference tables and doors and things like that in and out. What we ended up doing in that middle school was disinfecting and sanitizing the school every day and cleaning desks every day. And what I didn't know when I started my career 20-something years ago was that school desks weren't cleaned every day. They were cleaned a couple times a year and maybe wiped down. So now we were doing a thorough cleaning every day with the same time and the same resources by using technology and training. So that was very exciting. And they're still doing it today. So next slide. So this is it, Salt Lake City. This is an ATP series, so adenine triphosphate testing. It's a swab with a meter, and it's not hard to take the readings. What is hard is knowing where to take the readings so they mean something and they show what's happening day to day in a part of your facility, and then it's how to analyze those. So the first column is the readings at the end of the day, so 2 or 3 in the afternoon before the janitorial staff came on, and what happened during the day and the dirtiness. So what you see here is the Dyson dryers where you put your hands in. Those were very high because what we learned is that they're enclosed, so the water that comes off your hand can stay in the bottom of those dryers, and things in the air can deposit, and it can be a growing place for bacteria. So just knowing that out of this ATP series is amazing. So we know, right, when we're placing those dryers, buy open bottom ones. And then the second from the back wall sink on the side, we found that was very high at over 600. And the first stall on the inside latch. So we know people walk in and a lot of times we'll go to the first or second stall. So I look at that and research it and how do people use a bathroom and all this stuff. So we got some of the really high readings. What's considered okay for ATP readings is 30 or under. So we only had one, the seat cover dispenser in the girls' bathroom. So the girls weren't using the seat covers. And then we took ATP readings after they cleaned that bathroom. So you see the dryer, we dropped down 90% just by cleaning. And in this school, we cleaned with aqueous ozone. So that's on-site generator of a cleaner. If you don't know about aqueous ozone, you need to look into it. It's a technology that you have to buy equipment for, so it's a capital investment. But you add water, plug in your machine and push a button, and you always have cleaner. So it's sustainable, less solid waste, less buying of packages and cases of cleaner. And aqueous ozone can replace glass cleaner, hard surface cleaner, stainless steel cleaner, and floor cleaner. It's very, very powerful, but we need technology to use it. So the reduction of just cleaning with a spray and vac machine in that bathroom, so it's the technology of the spray and vac, and then it's the chemistry of the ozone, we reduced at the minimum 83% of the soil load and the ATP on this. So ATP collects, it's what is in live organisms. It's what's the energy producer in live organisms. What I can't tell you with ATP, if it's COVID, if it's flu, norovirus, or if it's grapes. So in my lab, when we used to artificially inoculate something to show ATP, we would take a grape and cut it in half and rub it on a surface, and we would get a very, very high reading. So then we could do testing of different products or different equipment and how we were reducing that ATP. So I can't tell you if everything that was on there was a pathogen, but there's some in there, you know, and the soils that are on there, even if we can't see them, are harboring them and protecting them. So that's why we clean first and remove 90% of, around 90% of soils and whatever's in there, including pathogens. So the question many times to me is, then why do we need to sanitize and disinfect? Isn't 90% enough? Well, with pathogens, with bugs, with germs, you could have 1 billion on a surface. So 10% is still 100 million. It's still a lot. And I would want to remove that. So what we do is we go in to kill that. So we clean and remove first, 90%, and then we go in to try to kill that last 10%. And what we did at the middle school was we weren't in COVID, so we went in with sanitizer, not even disinfectant, sanitizer. And we got down to our highest ATP in that restroom was 14. That's it. This is hospital grade cleaning and disinfecting using the least toxic and best cleaner and disinfectant in the world. I've built my career on these chemistries. There are other great ones, but these are the ones we were using in that middle school. And we show that even that last 10%, we reduced that by another 90%, 89%, 87%. So the process works. The two-step process works. And this is proof of it. This is data. This is proof. Next slide. So basically, spray and vac systems save time. Some of you probably have them in your closet, a Tyvek, a NSS, a Clark, and more. The system that we used to generate the ATP readings in the slide previous was a clean core caddy, and that caddy produces aqueous ozone. So they're all spray and vac. You spray them down, you spray your porcelain, you spray your floor. You can agitate it with a brush. You can spray it on mirrors, glass, you know, partitions, and then you can wipe it off. For the floor, you can vac it up, and those vacuums on these machines mostly will vac up to almost a dry surface. Okay, so NSS, Clark, and Tyvek, you have to put a bottle of other cleaner on there that feeds into the system with the water that you have in it. The clean core doesn't. So the clean core is what we call on-site generation. You put water in their caddy, you hit a button, you plug it in and hit a button, and you generate your cleaner. Okay, so you're paying for the equipment just like you are for these other ones, but you're not having to buy anything else. Okay, it is on-site generation. You'll hear me talk about more sustainable. We did with Clean Core, I did a sustainability study at Clemson University, and we found that we were saving about 70% of chemicals, concentrated chemicals, as well as 70% of plastic and cardboard. And all of that also saves time. So you're not ordering as much from your distributor once you buy an on-site generation machine. You're not receiving, you're not stocking it in a warehouse. You're not moving it to janitor's closet. You're not opening the boxes. You're not diluting it. So there's a lot of little time things that going to on-site generation also help. So over a year, over 6 months, over a month, your supervisors and the things that are doing it, they save you money. So this isn't just about buying a piece of equipment versus buying concentrated chemicals. This is about some other factors that come in to save you money. So, and then hand cleaning with just cloths, not clothes, Heidi. Hand cleaning versus going in with a cloth and a spray bottle versus machine cleaning with a spray and vac. The spray and vac is faster and it gives you a better clean. In Salt Lake City, we found that they use some students sometimes to help clean, and they don't want them cleaning bathrooms. So what they did was we had one specialist clean the bathrooms, and he spent about 6 hours a night doing the gang bathrooms as well as doing the little bathrooms for the teachers or for the office or things like that. So what happened is after they started using the spray and vac machine by CleanCore with aqueous ozone, they found that they saved 2.5 to 3 hours a night in bathrooms because they weren't hand cleaning, they were spraying and vacuuming. We believe the clean was better, and it was a great outcome. So that 1.5 to 2 hours a night was then being able to be spent taking your electrostatic sprayer and taking aqueous ozone and spraying the elementary school down and the middle school. So what I've seen in the field is an elementary school can take 30 to 45 minutes to disinfect at the end of the night with a sprayer, and then a middle school is bigger and a high school is bigger, so a little extra time. But you know, if we can save you with training and with spray and vac in the cleaning portion to about 2 hours, then we can sanitize and disinfect. Next slide. So how do I know this stuff, right? I'm not a facility manager. I'm a microbiologist and chemist that was lucky enough to be working in a laboratory for a state when green cleaning came along, and I was kind of let go in the field, and I worked with some of our biggest agencies in Massachusetts on how to implement green cleaning. So implement the products, implement the equipment that worked in the specific situations for each facility I went into. So I'm considered kind of an end user scientist. I love the lab, but I love to get into the field and work with the people. I don't just walk around and go do this and do that. If I'm in a facility, I work third shift with your people. I clean with your people. I train at the same time, and since I'm taking their time, I help them clean. You know, that's the way I build respect. That's the way I build trust, you know, and that's the way I help you get buy-in with your workers is I'm in there, right? In t-shirt and jeans working. Testing and piloting in actual facilities with actual custodians. You know, even if I'm not involved with someone like me, you can do pilots. Listen to the feedback. I listen to the feedback and I report to manufacturers and I say, the people from in the field, your end users, your customers do not like this. They do not like that. So I try to work with the manufacturers that listen. And I also don't just talk to the managers and the supervisors. While I like all of you guys, I want to talk to your workers. They're cleaning your facility 8 hours a day or more. They know things, right? Maybe they don't feel like they can speak up, but they know things. And I want to hear from them. I work on the data and the proof. Don't tell me. No manufacturer is going to tell me my product does this and it's new and it does all this and I'm going to believe them. I'm going to go, I want to see your testing. I want to talk to your customers. I want to see your case studies. If they don't have that, then no one should work with them. There's no proof. Okay. So I vet products and I hold manufacturers' feet to the fire before I even talk about a product. And I'm always looking to solve problems with solutions that work, that are less toxic, that'll work for a long time, that are flexible and economic. If it's less toxic, but it's 10 times as much money and it doesn't perform, like someone asked before and said, people don't trust green cleaning, then what's the point? So I spent my 20 years at the state of Massachusetts using those three premises. Is it effective? Does it work? Does it do what it says it's going to do? Is it economical? Is it in the realm of possibility? Okay. And then how toxic is it, right? We need to know all of those things. Next slide. So this is hand versus machine cleaning. And what you can see in the first column is just the ATP readings dirty. This was in an airport, so an international airport. And then we did ATP readings after with traditional cleaners and hand cleaning. And then we did it with Clean Core Caddy again, so spray and vac with aqueous ozone. And look at the numbers. Half, a third. That last column shows that we get a better clean and we do get it faster with the actual spray and vac machine. So that's your proof. Next slide. Next slide, Luann. Okay, so again, spray and vac machines, proof data pilots. We want to look at things, 2-bay mop buckets, that empty from the bottom. We don't need to, you know, your little worker doesn't need to pick it up and wrench their back. Machines that strip floors without a lot of stripper. We use pressure pads, water, they exist. These are equipment and tools that can save time. A carbon pole system by Unger means your people can stay on the ground and clean up to 30 feet without getting on a ladder, so safety right there. And again, the CDC and the industry, best practice are to clean first, most important step in removal, and then we're gonna kill or disinfect. Next slide. So how do we know what to do and what to use? Okay, so obviously, hopefully you have a good relationship with your distributor or your vendor. You can look at what they offer, but really vet them. If you're confused, we're best friends now, so you're gonna have my information. If you have a quick question, please, you can email me and say, what do you think of this? I will email you back and say, this is what I think, this is why. If you want me to do more with you, we could obviously talk and hire me, but I will always answer a question and go, you know, my vendor's pushing this, they're saying it's better than that, or this, that, and the other thing, and I will do a quick review. Read your trade magazines, watch things on LinkedIn, what people are talking about, talk to your peers. You'll see advertisements in your trade magazines. If you're not using cleanlink.com from Trade Press that does Facility Decisions Magazine, or CMM through ISSA, or all the other publications through Trade Press, Contracting Profits, and those. If you skim through those, you're gonna see stories about some of the same problems that you have going on. And you're also gonna see advertisements for new products that you can look further into. And then you need to know the questions to ask for new products. You need to ask for proof. Okay, you say it does this, I wanna see the testing proof. I don't wanna see your summary. I want to see your proof. What lab did you do it in? What test did you do it in? What did you follow? What did the data show? Did a third party help you with that data? All right, this can't be about the manufacturer and their customers. And then do they have references? Can you call somebody up, you know, from New York into Utah or into California and say, I heard you use this product, I'd like to talk to you about it. Right? Then you need to think outside the box sometimes, make a case for change. And new technology and chemistry is now more important than ever. So if you haven't looked into it, embraced it, please do. Next slide. Okay, next, so questions asked about new products. Again, we've kind of talked about them. Ask about asthma, ask about the active ingredient. So this is very, very important with your sanitizers and disinfectant. Is that active ingredient on an asthma list? Is it biodegradable? Does it have a lot of synthetic chemicals and fragrances in it that can harm people? Again, ask for case studies, ask for environmental fate testing. So when we're thinking about coatings, right? A coating is gonna go on a desk, a surface, a locker, whatever, and it's gonna help us do what I was talking about, not just the surface cleaning. We can clean that surface with a coating on it, but then there's residual antimicrobial effects. So basically, it will kill things that land on it during the day. These are products that we need to look at now more than ever. But some of them, while they will have testing that they kill things, right? They will have testing from a lab that they kill things. They may not have testing about what happens when the coating comes off. So if you have a coating that's only good for 90 days, you should be asking what happens to that coating after 90 days, okay? It's like paint on your house. You put paint on, it comes off, you know, after 3 years or 5 years or 10 years, it comes off. The paint falls into the ground. It rains. It could get into the soil, the water. You know, we have to look at those things. And it's the same things for coatings. You should ask if they've done any environmental fate testing. So when the coating is abraded off, it's in the soil, it's in the air, it's in the dust. What happens to it when it gets to fish, it gets to humans, it gets to whatever. And if they haven't done that testing, you need to question the coating or question the product, because the worst thing would be for somebody like you guys to put a coating in a facility and then we find out a year or 2 or 3 later that it's actually poisoning people or doing harm when it comes off. Or we can also find out that it's great and it's benign. And that's what we want. I want these products to be good, to do good, but I have to have the proof, okay? If they can't produce the data, if they can't answer these questions, then you should walk away until they've done it. Next slide. So what else? Know your disinfectant. So again, we've been hearing disinfect, disinfect, and disinfect, the N list. Yep. So the thing is coming through is do your homework on the coatings, look at the coatings, see if how they're applied as well. Are they water-based? Do they have a solvent? Is that solvent gonna, you know, gas off into the air? There's a lot of things to know, okay, about new products. So for your disinfectant, know the active ingredient, know it. Okay, so on an SDS, there will be the active ingredients that have to be reported on there, over 1%, I believe, in volume in the chemistry. And the CAS number will be there. The CAS number is the fingerprint for an active ingredient. Okay, look it up. You can put a CAS number in and it will tell you what it is and what some of the hazards are or what the issues are. You could ask a friend, which is me now. You could ask yourself, you know, what do you want to kill? What ingredient kills it? If there's more than one, then you can pair them. There's always hazards of sanitizers and disinfectants. They are registered as a pesticide. So if you read anything from anybody off the N list that says, you know, this is non-toxic, this is safe, this is whatever, you should walk away. The company doesn't know what they're talking about. It's never non-toxic. And you will look at the efficacy of the kill, the cost, the health, and safety. Next slide. So COVID is easy to kill. It's easy to kill. If you don't have it in your facility, you clean and disinfect as you should. If you have it in your facility, you do the protocol. You either shut down your facility for a day or for a week or permanently. But if 1 or 2 kids gets COVID in your facility, you don't need to necessarily close down your facility forever. You don't have to go to remote learning. It's easy to kill. If you know where that child has been, if they've been, you know, where they've been around or whatever, there's rapid tests coming out that schools should have, kind of like the Patriots that just had Cam Newton, our quarterback, just had COVID. What they did was they pushed the game till last night. Yes, it was horrible. And what happened was they tested everybody more than once with the rapid test, and everybody came up negative on the 2 teams. So they decided that they could play. Should we have maybe waited a week or 2? Possibly, right? Keep people quarantined. Cam didn't travel, he didn't play. But you know, there is a quarantine talk. There's still quarantine. We still need to stay away from people if we've been around. So, you know, those procedures matter, but we do not need to chemical bomb your facility. Okay, you don't need to do that. COVID is easy to kill. If you had a C. diff outbreak, if you were a health facility, the hardest thing to kill is a spore. And then we would need to do a lot more work. But do not go crazy. Do not chemical bomb your facility. Supply chain issues now we talked about. I'm a big proponent of on-site generation. This is because you have the equipment, you have salt and water, electricity, and you have your sanitizers, your disinfectants, and your cleaners. There's also, that's not to say, supposed to say so, that's supposed to say no synthetic fragrances or dyes, no residues left behind, no asthmagens. And I've spent, that's not 2, that's 20 plus years in the lab and training to fight COVID. So I'm ready for this. Next slide. The end list. Let's go back quick. So this is a comparison, like I told you. So chlorine, bleach, quaternary ammonia compounds, and hypochlorous acid. Chlorine, bleach, and quaternary ammonia compounds are the 2 most prevalent chemistries on the N list. Chlorine bleach is dangerous because of the high pH. It burns things, it hurts things, it damages things. It can do a lot, but it does kill a lot. It kills a lot of microbes and pathogens. Quaternary ammonium compounds, the same thing. Generally, we're always used in healthcare for the C. diff kill. Now they're used everywhere. They shouldn't be. They are, to me, paramount to poison. They are on the HOCI asthmagen list. This is the list that says whether a chemistry is a primary asthmagen or it exasperates asthma. Quaternary ammonium compounds are listed as a primary asthmagen, meaning one use in your house. So Lysol spray is a quaternary ammonium compound. One use in your house or your facility, somebody can get asthma. Primary asthma for the rest of their life when exposed. Doesn't always happen, but it can, and it has. Chlorine bleach exasperates it. If you have any breathing issues, it will, if your worker has asthma or has anything else, it's really going to be a problem for them. Hypochlorous acid, which is made by a tablet or a machine, is not on that list, is a neutral pH, which the other 2 aren't. So while hypochlorous is a chlorine based product and a cousin to chlorine bleach, the neutral pH allows it not to bleach out color in your fabric. So you can use this on, you know, carpet, you can use it on chairs, you can use it on a lot of different things, and it was not going to hurt it. It's EPA registered like the other 2. No fragrance and dyes, and you can look at this. I had a minute, so we got to move. So next slide. So application matters, trigger sprays, harder, less ergonomic, but they're what you should be using probably during the day. Spray a rag, and then wipe on it. And then on the bottom here is a new electrostatic sprayer other than Victory and E-Mist, which are right now price gouging. They're right now out of stock, and they have their own issues. This is a new one that I have found on the market. If anyone's interested, I can give you an introduction. They're not price gouging. It's working very well. Microfiber, if you're not using it, you should be. We also need to think about the air columns, so dry fogging, and I can talk to anybody offline about this. Next slide. So sustainability, look into it, look at things that use less plastic and cardboard, mean it, it's important now. Next slide. Elephant in the room, we need to upgrade our systems. We need to add air purifiers, coatings, and other things. So we need facility improvements. Next slide. The baby elephant in the room, things I think about, so playgrounds, benches, athletic equipment, touch screens, putting toilet seats back in your bathrooms. You know, you need to think about that. Next slide. I think we're at the end. There we go. So I think I got it right in. So there's my email, there's my website, there is my phone number. The reason why I do this stuff is those 2 puppies are sitting right behind me right now. I use aqueous ozone and hypochlorous around them every day. And then that is my nephew. And since he was born and his sister, they have used the hypochlorous disinfectant that I've given my sister-in-law for the last 12 years. So I believe it and I use it as much as I talk about it and educate about it and tell you. So I know we answered questions during, I don't know if there's any prevalent ones, Luann. I don't think
Yeah,
it.
thank you so much, Heidi. We're going to have to move on. Thank you so much for your
Okay,
presentation. You did capture a lot of the questions during your presentation, and now everyone has your email address. So please
great.
write to Heidi. Next up is our keynote speaker, Merlina Valentine, excuse me. Head back to the auditorium to join the session. Thanks very much, everybody, and thanks
Thank
again, Heidi.
you.